with Steve Edwards, President and CEO of Cox Health.
Correct.
We're doing our Outlook interview for healthcare for 2017. You're probably familiar with it.
Yes.
Yeah, so we're just taking a look at, I think, 15 or 16 industries, something like that, getting a kind of a broad stroke prediction at 2017. So we're kind of all starting with this broad question for your industry. Like, what's your biggest prediction, your top prediction for 2017 in healthcare?
Yeah, so I'll begin by saying that whatever the Affordable Care Act has come to be will change.
Okay.
It will change in some important ways and in ways that are worrisome. Because whether you like the Affordable Care Act or not and what it's done, the way it's constructed, it would be the equivalent of deconstructing the Eiffel Tower from the middle down. You know, you have to deconstruct it in an organized way. The mandate for care makes the insurance model works because everyone has to.
Sure.
If there's no longer a mandate, which is likely, the requirements to insure everyone only if they want to at certain rates, the math doesn't work anymore. And so we know that with the appointment of Dr. Price, he spent the last part of his congressional career learning how to deconstruct the Affordable Care Act.
Right.
He knows how to do it. We think a lot of it will be done through budget reconciliation by defunding programs. And so look to see changes on the exchange. Medicaid expansion, which has occurred in some states, 31 states, will likely be put back in the state's court without funding, we think.
Oh, yeah.
And without funding, that'll be a problem. Missouri never expanded.
Yeah,
So,
did they miss their chance then?
yes, and $2 billion a year of funding.
Yeah.
So that's not going to happen, we're pretty sure.
Mm.
What we hope is that if Missouri was being fiscally prudent by not expanding, that will at least be recognized by the Republican administration.
Oh, yeah. Okay.
Instead of those states that expanded getting resources and our state continue to not get resources. So we hope that there's a balance because it really hurts us not to have that expansion.
Mm-hmm. Yeah, so you think the mandate's going to go away in 2017? Is that?
I do. I mean,
that quickly?
If you, well, I think the process to make it go away will
Okay.
happen in 17.
Yeah.
I believe with the appointments Trump has made, for example, Price, but also with Health and Human Services and CMS program coordinator, you've got one person who wants it to go away and one person who developed it, the Medicaid Expansion program in Indiana under Pence. And she's brilliant at it. And so I believe it's probably prudent that there's so many people with coverage now that if you strip it away, it will be politically difficult, and so they need to kind of phase it in. I imagine block grants will go to states, let states decide, and put the responsibility back on states to the federal government. That's my guess.
So it doesn't sound like we're looking at an Obamacare that's gone, but more like an Affordable Care Act that's way different than it is now, or
I think there's
lessened.
It'll be
version?
lessened for sure because
Yeah.
that's how almost every Republican elected ran their campaign. Americans like the coverage, they don't like the mandate. And so I think there'll be work to remove the mandate. Unfortunately, removing the mandate takes away the economics that make it work. So look to see it deconstructed with more of it back on states to make it work.
Yeah, so that's how the funding will be shifted.
Yeah, because the repeal requires 60 votes, and that's hard to get. But you can defund things through budget reconciliation.
Okay.
And so unfortunately, the way you can tear it apart through defunding is an unstructured way and could be a little chaotic. So we're a little worried about that, how it can be reconstructed.
Okay. So, I mean, beyond the Affordable Care Act, I mean, do you see Donald Trump being having any other effects on the healthcare industry beyond? I mean, that's going to be the main one, obviously. But.
Yeah, I mean, he ran almost on a mandate to do something about the Affordable Care Act. And I think it's because the tax burden on the working class in terms of seeing their higher insurance rates go up is what won him the election. They feel like they're working hard, and there's people that aren't working, and they're subsidizing them. The middle class didn't like that. So he has to do something with that. I think he will. You know, there are other things. We will see, I think, a focus on the opioid crisis, which when I even look at our own city And when I look at the violence going up, the crime rate going up, and know that there's a direct correlation, there's research that says 80% of all new heroin addicts started with opioids. It's so similar, and when the prescriptions run out, that's their fallback. And so that's a national crisis. I think there'll be some attention. Missouri is the only state in the whole union that doesn't have a database for opioid.
Okay.
So people can doctor shop and go to pharmacies and get prescription after prescription after prescription. Every other state, there's a database so people can't abuse it and sell it, etc. We're surrounded by so many states that we've become this mecca, and we've blocked it in our state, the only state. That will probably hurt us, because as a nation looks to improve the opioid crisis, our state has rejected those measures and will probably be punished for it and not get funding. So that's worrisome.